Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
To the College Connection podcast. The College Connection podcast is made available to RNs and NPs as a resource to promote good practice and to highlight the importance of regulation in healthcare. My name is Kelly Kane, and I'm a registered nurse and a nursing consultant with policy and practice at the college.
And I'm Michelle Carpenter. I'm a registered nurse and a nursing consultant for policy and practice at the college as well.
We have a great show for you today as we discuss part 2 of the evolution of virtual nursing practice. Our guests today are Charlene Brophy and Valda, and let's jump back in where we left off. In a system that struggles with overcrowded emergency rooms and very lengthy wait times, what are some examples of how virtual care should be option number 1 as a means to reduce some of these pressures?
Yeah, and I think, I talked earlier about the overcrowding problem in our emergency rooms, and I think we all have come to the realization this is not going away. In actual fact, it's only going to continue to get worse if we don't come up with a creative solution and so on. And, what we're experiencing in Newfoundland and the long lines and long waits in the emergency room because we're all getting older, because we have limited access to resources and so on. And, we've just got such a large geography in Newfoundland and Labrador. Just trying to figure out a way to manage it is a challenge for us in this province, more so than many other provinces in the country. And the good part, that's the bad news. The good news is that we're pretty creative people here in this province, and we learn to spend pretty quickly in order to find a way to look after one another. And even though 811 has been in this province for many, many years, prior to the pandemic, there wasn't a great awareness of the 811 services and who could call and what they could do for you and so on. But again, the adoption that happened, as I spoke about previously, that happened overnight because of the pandemic with 811 services, has not only remained quite high, but it continues to grow, believe it or not. And depending on what's happening in the communities at any given time, and if there's an outbreak of the Norwalk virus, then we can plan on the number of calls relating to vomiting and diarrhea that's going to come in the next 48 hours and so on. So for 811, that what's changed about the public perception is that once upon a time, anybody that called 811 and was sent to the that called 811 and that were really sick were always sent to the emergency room. And we heard that ourselves, and that was always difficult for us to hear when we knew that wasn't the case, because as a health contact center, we monitor the data very, very carefully and compare ourselves to continent-wide standards for the number of dispositions that should end up in the emergency room and home care and advice given and so on. So we monitor those numbers very, very closely, and there's predictive analytics that help us determine what outcomes should be happening and so on. And we were always within those outcomes, and we still are. But what's changed now is that the awareness is that not everybody does go to the emergency room. In actual fact, only roughly around 11% of people, anywhere from 9 to 11% on any given month, of individuals who call us who said that prior to talking to us they were going to go to the emergency room, only 9 to 11% of them go to the emergency room. So those numbers are pretty phenomenal. And of those patients that are referred then from a registered nurse to a nurse practitioner because they need diagnosis or prescription or further treatment, whatever the case may be, less than 1% go to the emergency room. Wow. So the numbers are pretty astounding. Now, historically, patients still went to the emergency room and sometimes still do today, because the sad reality is they have nowhere else to go. Mm-hmm. So if you've got a urinary tract infection on a Friday evening, who can wait until Monday or Tuesday or Wednesday when you can get in you simply can't. So what we've tried to do in supporting the system through the virtual nurse practitioner program is to enable people to receive that care in real time without having to wait extended periods. Number one, feeling very sick and unwell, but number two, putting themselves at risk for additional complications Absolutely. Because it wasn't treated. So the awareness that has happened in the province from 811 is not everybody goes to the emergency room. In actual fact, once the numbers are out there and the stats speak for themselves, most people are not referred to the emergency room. and that, the province in supporting the 811 program went a step further, enabling us to hire 70 plus nurse practitioners now. So for patients who need that care, we can escalate to Valda and her team. And Valda, you guys are making a real difference in providing that care and keeping people out of those emergency rooms, as much as possible. I don't know if you want to speak a little bit to some of those types of calls and care you're providing and so on.
Absolutely. And so, a couple of ways actually. So we also have within our nurse practitioner program a direct transfer program. So every day we save so many appointments for those dispositions whereby if they're seen by the registered nurse and they need to receive care within 1 or 4 hours, or it's recommended that they need to seek other care within that time frame, they can be escalated directly to a nurse practitioner. So instead of going to the emergency room, then instead they're escalated to the nurse practitioner. They receive assessment, diagnosis, and treatment. And like Charlene said, less than 1% of those that are seen by the nurse practitioner need additional care and resources. So that's a valuable program. And then there's our emergency room program, right? So what the virtual emergency room program has allowed, not only do we assist with staffing these sometimes rural or remote emergency departments that are experiencing difficulty filling their human resources, we also provide extra capacity to help deal with the volume of patients that are coming through their emergency rooms. So what that looks like on the ground is when a patient presents to the emergency room, they are triaged in the same way by a registered nurse on the ground. And if they are deemed to be a CTAS 4 or 5, which is a lower acuity score, and that would be again conditions such as med refills, sore throat, sinusitis, urinary tract infections, that is what is a CTAS 4 or 5 score. If they receive that score, then they can be escalated to see the virtual nurse practitioner. So the patient is brought into a room with a telehealth unit. The nurse practitioner is on the video screen. The patient then sits with the registered nurse or licensed practical nurse who assists them with the call. And that patient then receives assessment, diagnosis, and treatment right then and there. If any hands-on assessments are required, the registered nurse or LPN can help with that. We use the peripheral devices such as virtual stethoscopes, virtual otoscopes to look in the ears, and a general viewing lens to look at skin lesions or to diagnose strep throat. And then if treatment is required, we fax the prescription directly to the pharmacy of choice. If labs or diagnostics are required, they then go and have those collected and come back to receive the results of those labs and diagnostics, and then can be discharged home. So it reduces the wait time in the emergency department, and research shows that a significant portion of what is presenting to emergency departments are actually these lower acuity scores of CTAS 4 and 5. So by diverting these lower acuity ones to a virtual option, it's allowing the on-the-ground resources better able to focus on the higher acuity, the more sick. So it's a better utilization of existing resources.
Yeah, and you mentioned about the number of calls or visits that you have. So that's quite significant when you're, decreasing it to having to go to emerge, 9 to 11% or 1% when you talked about seeing the nurse practitioner. That's significant numbers that are, staying out of the emergency departments.
It really is significant numbers. I think in real time when you're in the emergency room and you're looking around, it may not feel that way because, when you're at an emergency department, you're sick. And it may not always feel that way, but just imagine if we didn't have 811 and we didn't have nurse practitioners and, those numbers were increased by 90%, we can't even imagine what it would look like. And the other consideration is how sick would people be? Mm-hmm. Because, you get to the point, I think, many times when you're just too sick to go.
Yeah,
and, how sick would people be because they couldn't go and wait 24 hours to be seen? And, all of our emergency departments departments, they're working, their darndest to try to get through patients as quickly as we can. But the reality is we're seeing a higher acuity level of the patients that are coming through our doors today. And it's complex situations that are not, quick and easy, assessments to get in and out and so on. And so trying to fit those on our non-emergency test 4s and 5s like you talked about in between those very complex, very ill patients, it's a challenge for emergency departments. So we're really, we're honored to be able to do what we can to support them, to help enable them to get through as the very best they can.
Absolutely. And in part 1 of our episode about the evolution of virtual nursing practice, we talked about how Charlene and Valda are a part of Fonemed, and I know you were just talking about 811. Can you just explain to our listeners Fonemed and 811 and what that relationship is?
Yeah, absolutely. So I had said in the first session that we had, when we had chatted, that we've been in business now for almost 27 years, right here in Newfoundland. Started the company here in Newfoundland. All of the senior leadership team who run the entire organization, not only the North American operation but global technology operations, are based right here in Newfoundland. So it very much is a homegrown company. So we had been in business for, I guess, maybe about 10 years before we took over the Newfoundland and Labrador 811 health line. And so we've been running that now since 2009. And then 3 years ago, I guess 2.5 years ago, we added on the mental health crisis line. We took over control of that as well. So today in Newfoundland and Labrador, anybody that calls 811 from either local landline number will come through to one of our nurses in Newfoundland and Labrador. All of our nurses today who are monitoring that and responding to calls on that line are located right here in Newfoundland. All calls are answered in Newfoundland. We've got agents answering phone in every nook and cranny you can ever imagine, right throughout the province. So we're really proud of that because we've become a significant driver of employment opportunities in many rural communities and so on. So individuals call 811. Most people who call, about 80% roughly, are symptomatic, so they're experiencing a health issue. The remaining 20% are calling with questions such as, can I take Tylenol if I'm on this antibiotic, or whatever the case, like their medication compliance questions. Or they may call and say, well, the doctor said I have whatever, what can I eat or what can't I eat, or, they're looking for general medical information and so on. So that's the bulk of the type of calls that we have come into the program today. A significant number, there's been a significant climb in the mental health calls, since the pandemic for sure. But it's like when you're sitting in an emergency room, you don't know what's going to walk through the door next. When you're on the other side of that 811 line, anywhere in Newfoundland and Labrador, you never know what call is going to come in either next. So it's being prepared and having a general base of knowledge so you're able to deal with both pediatric and adult type of situations and respond appropriately.
Well, I'm glad you talked about mental health crisis line because that's my next question. So gaps seem to be prevalent with respect to mental health. And what are some of the advancements that are being made in virtual mental health care?
Yeah, so, there have been significant advancements. There's no doubt about it. There's significant awareness of the resources that are available today, whether it's digital access to resources or virtual counseling platforms and so on, and self-help tools that people didn't know about previously. So there, we've made certainly significant advancements in raising the awareness of that, but I will tell you what it's also done is raise the awareness of the great need we have in this province for more. And I think, what we're providing now, it's doing the best we can with the resources we have, but boy, do we still have a long ways to go in meeting some of the challenges. And people are really struggling. They really and truly, they're struggling to get a diagnosis, the right treatment plan, to get advice, to have counseling sessions, and finding the right connection with the right provider in mental care is more important. Mental health care is more important than ever. So we're doing everything we can to move that as quickly as we can, while at the same time finding a balance in making sure that what we're doing is providing safe, competent care in an efficient manner as much as possible, but at the same time not putting anyone at risk. So we've come a long ways with the advancements in some of the digital technology piece, allowing people to connect differently. We've done a great job in making connections with a lot of the community resources through our database and what's in different communities, either for walk-in or virtual sessions and so on, and to take away the stigma that still sadly exists when it comes to mental health related issues and so on. So made great advancements there, but we're still working on that, and that's still very much a priority for our organization. And it's a priority for us because we see the need. Here in Newfoundland, more than anywhere else, we're seeing a great need. And we're constantly talking about who else and what else do we need. You know, we've brought on registered nurses and agents to help answer call, and navigators to help find care, and dietitians to provide advice, and made connections with an interdisciplinary team as much as we can. And the nurse practitioners have been a big piece of that. But as next, we're thinking, who else and what else is next? What other discipline is there? You know, we hear reports from parents who are waiting for 1 to 2 years for an ADHD assessment. So, you know, we talk all the time, what can we do about that? Or are waiting for an assessment by psychiatry services or whatever the case may be. So everything we do now in all of our sessions is we're looking forward at what's next. It's all about, well, what's the need? And the need, since the beginning of time when we started the company, has always driven our strategic approach. And we spin very quickly because the need changes in communities very quickly, but everything we talk about and do and plan for now, when we look at what's next, is what's the greatest need. And mental health, even though we've made significant advancements, we still got a ways to go.
Okay, thank you. And Valda, can you tell me about some of the programs that you're offering for mental health and addictions, and
Absolutely.
how the NP provides care as well?
Right, absolutely. So, as previously mentioned, we have a nurse practitioner program that does several hundred primary health care booked appointments every single day. And, you know, they can include mental health conditions, assessing, diagnosing, managing, treating mental health conditions as well as other chronic diseases. And we also have a managed care mental health program as well. So, this was a program that was developed in collaboration with key stakeholders in the department. If a patient had a condition such as ADHD and was receiving treatment with a controlled substance, it can be quite challenging to get access to care if they lose their primary care provider, right? So they may have been previously diagnosed or received psychiatry services and received treatment for their condition. But the reality is, without someone to enter into a longitudinal relationship with them to continue on that treatment, there is a big gap in access to care for this population. So in this managed care program, that's what we do. We roster the patients to our managed care program. We do a lengthy intake assessment, a safety assessment, and we continue their much needed treatment. So that is one of the other programs that we do to address mental health conditions.
And so are nurse practitioners able to do like cognitive behavior treatment or wellness programs or anything like that? Do you
Yes.
have access to that?
Absolutely, and we also, have a list of resources as well, so that we can, escalate care where needed to specialists. We can escalate care to other allied health professionals to receive more specialized treatment. We can refer to psychiatry services where deemed appropriate as well. So, the patient always is in the center, and then we try our best to wrap services around them where deemed appropriate.
And it was really interesting when you talked about, those longitudinal relationships with clients and, the requirements for controlled drugs and substances. And it's nice to see that, you're very cognizant of that when that is a part of the MP standards under client care management, standards and indicators 712 to 717. So good to see that, that regulatory part is being built into your processes and your requirements. So it's really good to see that.
Absolutely.
Yes.
And, we follow the same safety contract that the family care teams utilize as well in terms of, entering into longitudinal relationships with the patient. So we do our best to provide safe, competent care.
That's right. I mean, sometimes, the public and your clients, they might not be aware of the standards of a registered nurse and a nurse practitioner, and needing to have that longitudinal. So it can be quite frustrating, I guess, for, for clients thinking that it would be relatively easy to access these medications when certain standards need to be in place, right? So it's really good that, you guys have found a way to make that a reality, I guess, for clients.
Absolutely. And the reality is that we want to protect our youth and the population in general. And these medications can be highly diverted and used inappropriately. So we want to make sure that we're putting processes in place to be able to provide safe care for those who need it, but also to protect the public as well.
Absolutely. Great. Excellent.
And you both have talked about working with other healthcare professionals, and we see that in a variety of settings now as well. But how does virtual health fit into a scenario such as this, where you have a lot of healthcare professionals working together for client care?
Yeah. And I just spoke a minute ago about what's next for us. And a little bit of the growth that we've had is because of those what's next conversations. So a number of years ago, we were experiencing a very high volume of calls for people looking for advice, like newly diagnosed diabetics, for example, who wanted to know, how do I go about what should I be eating and not eating? We were getting calls. I remember one in particular that one of the nurses walked in my office and said, this is the knowledge deficit that's there in the province. And should I just had a patient call whose blood sugar was through the roof, they're newly diagnosed diabetic, they've been so careful, and all they had to eat so far today was 4 apples because they're afraid. So she said this person had no idea that there was a natural sugar in apples. Like, there was such a knowledge deficit, and it was just an aha moment when, again, we thought, well, what else do we need? And, that's when, we worked with the province, came up with a program where we were to hire dietitians. So anybody calling 811 today, just as an example, in addition to getting, navigator advice and nurse practitioner diagnosis and labs and x-rays and so on, can also talk to a registered dietitian right here in Newfoundland and Labrador as well. So we've got 3 dietitians on our line right throughout Newfoundland and Labrador who respond to calls from individuals who are looking for advice such as that. Whether it's dietary advice, we get a lot of calls these days, relay from postpartum moms, questions about what they can and can't eat and drink and can't drink, or whatever the case may be. You'd be surprised about that. Or I have a really bad headache, what can I take for it? Like, it's those type of questions that are real life questions that if you're not clinical in background, you really don't know. And then for the individuals who are very concerned about weight loss, and that's become a buzz topic all of a sudden with the big Ozempic drive and so on, that we're receiving a lot of calls about, well, tell us about that. How safe is that? This is the situation I have. I've got these medical problems, and then the dietitian will work with the nurses and the nurse practitioner to determine, is there comorbidities that would, I should say to the patient, talk to your doctor, but this, may not be the right program for you because whatever. What we're doing is advising and informing individuals so that at the end of the day, they walk away and make an informed decision for themselves. So the dietitian is just an example of one. And as I said earlier, when we're looking at psychiatric services now and evaluating psychologists and social workers and who else, who else is next on our team do we want to bring on to help us meet the demand in the province? And because we've designed and built our own technology and, we've got state-of-the-art telephony platforms to enable receiving calls from different modalities and so on, we can bring on any discipline anywhere to help support the needs of the province. So it's a really exciting industry to be in, and there's something so rewarding about hearing about a problem. And I'll always go back to you, Valda, when you opened up the clinic in St. Albans, which, by the way, is Valda's hometown. And what a proud moment it was to go home, and to go home with a solution to, providing care to people in her own community that didn't have care previously. And the beauty of being in Newfoundland, running the 811 program in Newfoundland, is because we're Newfoundlanders too, and we care about each other. So we care about coming up with a creative solution. So the multidisciplinary team is top of mind, and I think you're going to hear, in months to come about significant advancements in what we're providing today and what's next.
That's good. Absolutely. Excellent. So it goes without saying that rural and remote areas of the province are sometimes the regions where there's a shortage of healthcare professionals. How has virtual NP practice elevated the level of healthcare services in these areas, Valda?
Absolutely. So in a lot of these areas, there would be no services without virtual options, right? So St. Albans was one example. So now, while they have a rotational family health care team there right now, their emergency room is shut down. And like Charlene said, it was a really exciting and proud moment to be able to bring virtual services back to my hometown, St. Albans. So they now have a same-day walk-in clinic. So patients can present to the clinic the morning of and receive care there same day. And so, while the ideal would be the emergency room to be fully operational and fully open, it at least provides some level of access to care for these patients. So as an example, one of my family members had a urinary tract infection and couldn't wait, would previously had to have driven 2 hours to either Grand Falls or an hour and a half to Harbour Breton to receive care. Well, now with virtual, they can connect with a nurse practitioner and in 15 minutes have treatment for their care. So, there's the difference in terms of bringing some level of care back to these communities. And again, I mentioned previously about the virtual emergency rooms as well. So in some of the emergency rooms that we help staff, these emergency rooms otherwise would have been shut down, right? So, that is a very exciting moment to be part of the solution to help keep resources in these communities and to work with existing resources or a team on the ground so that then we can provide access to care.
And what about acceptance? Because I remember, since coming here at the college and, hearing, I don't want to see a nurse practitioner. I'm going to wait until I get to see the physician. So how's that happened in these areas now? Is there acceptance of the nurse practitioner now?
It is growing. And I think, like anything, it takes time, right? And it takes exposure, right? So a lot of that happens when they haven't tried out the solution, right? And so, when we first helped with staffing the emergency room in Stephenville, we saw that happen in terms of patients would come into the emergency room, would sit and wait, and then here was this brand new, it was the very first emergency room that we started, and they were offered the opportunity to participate in the virtual diversion piece, and they said, no, absolutely not. I am waiting to see the physician. Well, as you know, the physician is tied up with the higher acuity cases. So hours and hours went by. Others came in and said, yes, I'll try the virtual option. They came in, got treatment, left. And those that initially refused were still waiting. So they were watching all of this unfold. Absolutely. And so then, they went back up to the triage nurse and said, I've been waiting several hours now. Can I try out that option? And once they tried it, well, then they embraced it because, wow, that was a lot different than I thought. It wasn't as scary as I thought. It did, he did take the time to answer all my questions. And so over time, it is growing. And so, that is what I would say to anyone who hasn't tried it out. Try it. It may not be for everyone. And yes, there is still cases that are too complicated and not appropriate for virtual, right? A lacerated finger will still be a CTAS 4 or 5, but that needs hands-on care. We haven't figured out how to do that one virtually yet. Who knows? Yeah.
We're not doing the virtual stitching yet.
Not yet. Yeah, so that that would be the strongest message in terms of try it out. It can help, and over time, I think we'll see an increased uptake in that solution.
Absolutely. Yeah. As you know, change takes time, but it's good to see that things are moving forward and acceptance of the nurse practitioner as the most responsible provider. So it's great to hear.
Professional regulation seems to be in the spotlight a little more recently than years ago. How important is regulation in this new era of nursing practice?
Oh God, it's the reason I sleep at night is because of regulation. And anybody that's been designated as responsible for patient care, I would think, feels the same way or should feel the same way. Because what it's doing is the regulatory piece is really laying the framework for the competencies that we all need as nurses in order to be able to practice responsibly and reliably and be accountable for our own actions. And it's a sense, certainly I think in nurses that I know, it's provoking a sense of trust in understanding that what they're doing in the practice of nursing and the duties that they undertake every single day are duties that they can and should be doing, and it fits in under the mandate or scope of practice of registered nurses or nurse practitioners or other disciplines and so on. And I think from a public trust perspective, I can't imagine earning the trust of the public if we didn't have that regulatory framework to say that, this is not just one group of individuals saying you should do this. This is what the industry is saying, and this industry is based on cross-jurisdictional constant communication with other provinces and other countries when we talk about scope of practice and what safe and competent care looks like for different competencies of registered nurses or registered or nurse practitioners or specialized practice nurses and so on. So I've never looked upon regulation as a barrier. I've looked on it as enhancing our ability to continue to grow more than ever now, because as we all look at this new era of innovation and what we're doing, and I remember way back when, all those years ago, meeting with the ARNNL, which certainly involves where you great folks are today, and just saying, I just want to be clear that this is what we're doing and this is how we're doing it. This is how we're making sure that we're providing safe, competent care. We've got very stringent policies and procedures and quality assurance programs, auditing processes where calls are recorded and reviewed regularly and so on, and ensuring that primary source verification for licensure piece, and how we're ensuring continuing competencies of the nurses who are practicing virtual care and so on. I had peace of mind all of those years ago when this was a brand new practice of virtual care that was almost unheard of in Newfoundland and Labrador. I had such peace of mind in knowing that I had you folks that I could come and talk to and say, this is what the plan is, this is where I'm going. And even now, fast forward 27 years to today, when we're talking about all of these new technologies and digital stethoscopes and otoscopes and, virtually listening to heart sounds and heart murmurs and diagnosing and so on. Like, it's a whole new world, this innovative new world that we live in. And even though it's exciting, at the same time, we're all got to be very careful that we're moving forward with patient safety at the forefront of everything that we do. And the regulatory pieces, for me, and I think for all of us, ensure that we're doing that in a consistent manner. And because of that, this is why when Valda talked about the adoption of our program and acceptance of the enhanced programs and services we're providing, is because the public have trust in us. And I think the public have trust in us because of you folks and people like you right across the country that are making sure that we're all, number one, informed and educated and aware of what the requirements are and scope of practice and so on, and that we're all ultimately accountable and responsible for the care we provide.
Absolutely, yeah. And thinking about, you mentioned standards, and no matter what practice setting you're in as a registered nurse or a nurse practitioner, it's all the same standards, right? For registered nurses, and of course, nurse practitioners have 3 extra standards that they must adhere to, no matter what domain of practice or practice setting.
Exactly.
So everyone, I guess, having an awareness of what their standards are, it helps, whether if you're in a leadership role, being able to, I guess, speak that same language with your staff who are registered nurses is really helpful.
Yeah, you're allowing us to continue to evolve, and how great is that? To have a partner, a trusted partner in the community that's a trusted partner for all clinicians, but a trusted partner for the community at large. We're very fortunate.
Absolutely. Yeah, because when we use that protected title of RN or MP, it's that assurance to the public that they're going to receive safe, competent care. With that means that you're adhering to your standards of practice. What's those minimum expectations? Using evidence-informed knowledge. So, evidence-informed knowledge, skills, and judgment. So, I'm sure as best practices come out in different areas with medications or, diagnosis, that your policies and your protocols are being up to date. And I think that's what it means to be a self-regulated professional, is having that professional accountability to adhere to your standards, adhere to the employer policies that you set, and adhere to any legislation, especially when we're dealing with controlled drugs and substances. So it's really great to hear that we're a helpful resource to the registered nurse and nurse practitioner, but you as a private sector owner of an organization. So it's great to hear. So we're going to talk a little bit more about regulation.
Everyone loves regulation.
Yeah, absolutely.
Yeah.
So when we think about nursing practice in the traditional sense, it would generally mean as an RN or MP employed in a health authority such as NLHS that a certain level of built-in regulatory framework and oversight is pre-established. But in a private sector environment, how do MPs and RNs ensure that they are properly meeting their regulatory obligations? And I think we might have talked a little bit about this, but could you expand a little bit on that?
Yeah. Do you want me to start, Valda?
You can.
So, I always say that it's such a gift to make a living, to earn a living caring for others. And, at the end of the day, no matter, for all of us, and I know it's challenging now in healthcare, and I know we're all tired and so on, but to come home at the end of the day knowing that you made a living by making somebody else's life a little easier, we're all still very lucky. But we do so because we're all aware of what it is our role is as an autonomous healthcare provider, because even if we're working for a health authority or working for a private company or whatever the case may be, and there's a whole bunch of national companies now that are providing care virtually and so on. So the conversation is more important than ever that we all as employers, whether it's a health authority or a private company such as ours, are always making sure that our employees are aware that they as employees who have received the designation of RN or nurse practitioner are aware of what their scope of practice is for that particular job, and that the provision of safe, competent care is first and foremost in everything that we do, but that every decision that anybody makes, whether you're making a decision sitting in front of a patient or you're making a decision over the phone over care that you're providing either hands-on or virtually, you're doing so as an autonomous care provider, and you're doing so under that designation of RN or nurse practitioner, because if that's your title. Regardless of who your employer is, it's the responsibility of that individual to make sure that they're practicing to scope of practice for what's considered best practice guidelines for providing that safe, competent care in whatever setting you may be located. So that autonomy piece, and I think in every setting I've ever worked in almost 40 years, I've always been aware of that. Whether I worked in a nursing home or in a very busy burn unit where sometimes you were kind of pushed a little bit, we're to the point where you're starting to feel a little bit uncomfortable because of some of the decisions you were making or so on, or fast forward all these years later to what we're doing today in virtual care. Every time we make a policy change or take on a new piece of work or contract or whatever, we do so knowing that our responsibility as employer is to make sure that we're not asking anything of any of our nurses, whether nurse practitioners or registered nurses, that could in any way, shape, or form push past that boundary of what a nurse or nurse practitioner should do in providing that safe and competent care. So I guess I'm going back to what I said originally. It's all about that autonomous decision-making of the caregiver who's responsible for whatever decision or advice they provide at any given time.
Absolutely, and that ties right into our first standard, accountability and responsibility, is that you are responsible for the decisions you make and the care that you provide and the inactions or those decisions that you don't make. So being accountable for the care that you provide through virtual care, virtual nursing practice. Anything you want to add? Sorry, Valda. Sorry.
Yeah, absolutely. The practice setting, whether you are in person or virtual, is irrelevant. As a nurse practitioner, we still have to make sure that we are within our scope of practice and that we have the knowledge, skills, and abilities to handle the outcome. And if we are being creative and innovative and doing something a little bit different, it's so important to have open communication channels with CRNNL, and we do. Anytime that we come up with a new program or do something a little bit differently to provide access to care, it is one of the first calls that we make. And of course, we follow the CRNNL Virtual Care Practice Guide. Yep. We follow CNPS's virtual care guidelines as well. And every time that we orient or bring on a new nurse practitioner, it is a strong piece of our orientation. And then we reinforce that on a daily basis with the expectations of what it is to provide safe, competent care. We have a very extensive QA process with Fonemed, so our calls are recorded for quality assurance process and purposes. And then we also routinely do audits of our calls as well. So we audit our nurse practitioner calls and provide feedback and guidance as necessary. So, it is a very extensive process, and I think it really speaks to the volume of the commitment that the company has to ensuring that safe, competent care.
Absolutely. And, we're always there to answer any type of practice call that we have, whether it's from the public service or the private services. We're there to answer any type of practice call. So you and I are on speed dial most of the time.
Yeah, we are.
I think back to when I first started here at the college in Valda, you were probably one of the first practice calls. I sat in with Michelle, and you were talking about controlled drugs and substances and how that's something now that Fonemed will be doing, and we were talking about the standards and the longitudinal relationship. So, it's very interesting to see. So, you certainly do reach out to the college, and hopefully we are of help.
Absolutely.
Yes.
We're afraid you're going to block our number.
And then, Charlene, going back to what you were saying about accountability, we often get invited into the healthcare system to do presentations for registrants on a variety of things, but we do always start our presentations with a little bit about regulation, and we talk about, that's exactly the quote that we say, your practice is your responsibility.
Yep,
right?
absolutely.
Because it absolutely is.
Yep.
As autonomous healthcare providers,
yep.
we are responsible for that license that we hold.
Yeah, and that just triggered something in my mind. As a self-regulated profession, we don't regulate employers. We regulate the individual registered nurse or nurse practitioner. So it's that accountability as a self-regulated registered nurse or nurse practitioner. You're accountable for your practice. And knowing what the standards are, knowing what your scope of practice is, knowing what legislation applies. So, it's I guess, reassuring to know that you talk about in orientation that you have to meet the standards of practice and know what the scope of practice is of RN or MP within Newfoundland and Labrador. So it's reassuring to hear that, so that's great.
And our final question for you today is a bit of a lofty one, but when we think about nursing practice and where it started and where we are today, especially with the integration of AI, where do you see nursing practice in the future?
Oh, it's going to be very different than it is today. Well, look how different it is today compared to when I started nursing back in 1987, and I graduated and what I could do then compared to what registered nurses are doing today. And I've got a daughter who's an RN today, and I still look at her and listen, and I'm still amazed at how the system has evolved. But if I look at the future and where we're going, for registered nurses and nurse practitioners is not only continued autonomy, but it's innovation and growth and leadership at a whole new level than what we're expecting today. And, nurses are already looked upon and have been since the beginning of time as a well-respected and trusted members of our communities and so on. And that's going to continue. And I think some people worry about the AI piece, and everybody thinks, are we all going to be replaced by AI and so on? And it's really important that the more people can learn about the AI, the more informed they are, then the more peace of mind that will come with it. Because AI is not going to replace us as registered nurses. It never could. It could never provide human-centric care. But AI is going to support us in a really big way. And a lot of the tasks that we're doing today that can and should be completed with the help of AI tools, that's what the future is going to look like. So the nurses will have maybe a different role if you look at building in some of the AI tools into what we do in a virtual care world today, where there's a lot of manual process when it comes to data entry for patient information, for example, and so on. That, patients are going to be enabled to do that themselves, and that's a good thing, because I always said the more that we can empower individuals to be responsible and accountable for their own care, the better. So a lot of that data entry and history taking and so on can be completed by the patient. So just imagine if you're sitting at home and you need an appointment, you need to talk to the nurse or nurse practitioner, and you got 10 medications. And you've got to wait till the person on the phone answers the phone, collects all of the information, and talks to the nurse, and she validates all of the doses and so on. Just imagine if the patient could have all of that step done beforehand. And then when you get your moment with the registered nurse or nurse practitioner, is your moment to really talk about your problem. Instead of spending 12 minutes documenting names and doses of medications and the times you've been in hospital and for what and what kind of problems you have, that's when you're going to see healthcare provided at its finest, in the most innovative way, where your time with a clinician is clinical time. Whereas right now, if we look at and measure how many minutes of every call to our center is spent doing administrative work, versus the nurse, the interaction, the clinical interaction between the nurse practitioner, registered nurse with the 811 caller and so on. That's how you know that you're making a difference, because you're using the technology and the AI to enable the best use of care for the clinician. And so we're really excited in a really big way. And we've got a team of software developers right here in Newfoundland who continue to do that. And every single day, we're thinking outside the box. So right now, if you were to walk into our office in St. John's and look, just see what sits in our entranceway and what we're developing for a virtual unit going forward, where when Valda talked about all of the devices that she's using in emergency rooms and so on, just imagine taking that on the road to every nook and cranny in Newfoundland and Labrador, where people, parents have got a child who's tugging and pulling at the rear, and we really need to have a look at that ear canal or eardrum before we can diagnose it. So imagine having that, where you can enable them. And that community is, that technology is right around the corner. You're not taking away the clinician, you're helping them work to full scope of practice in the most clinical effective way possible. So that's what we're working on right now. That's the future. And we've got a team here, led by our CIO, Kevin Hillier, and all his team of software developers and so on, and from a clinical lens by Valda and her team, that is just a team that's second to none. And even though, this is still what I do and what I've always done for so many years, I'm still wowed. Every single time I walk in or walk away or I have a demo with the technology that Valda's working with, I still walk away to this very day going, oh my God, this is so amazing. It's groundbreaking. And we're doing it here in Newfoundland. So the future is for nurses not to be scared of the technology, or for patients that they're going to call into 811 and they're sick and some robot is going to tell them what to do. That's not the way of the future. The way of the future is to enable clinicians to practice to their full scope, because we're providing a more efficient process to get them to the clinician on time. So it's exciting.
Fascinating times ahead for sure.
For sure. Valda, anything to add there?
No, I would just second what Charlene is saying, is that, again, just really look into what the needs of the community are, and how can we support that in an innovative, creative way. And that is what Fonemed works at every single day. So again, utilizing AI in a smart and efficient way to, streamline how we can collect the information, so that then we can spend more time with the patients and deliver better care. So that's always the vision.
Exciting times to come.
Yeah.
For sure. Well, thank you. That concludes our episode with Charlene Brophy and Valda Duke from Fonemed. Thank you, Valda and Charlene, and thanks to our audience for tuning in to today's episode. Take care.
This has been a presentation of the College of Registered Nurses of Newfoundland and Labrador.